What happens to your spine when you gain weight? The truth. We all know that gaining weight affects our heart, our blood sugar, and even our energy. But what if I tell you it also impacts something far more structural, your spine? Namaste, I am Dr. Vardhan, India's #1 Ayurveda spine specialist. Today, we are talking about some very real but often ignored consequences of weight gain, spinal stress, spinal degeneration, and pain. In this video, I'll share with you how excess weight alters a spinal alignment, why our lower back and knees suffer first, what modern research and Ayurveda both say about this link, and how you can manage your spine health even if you are struggling with weight issues. Stay with me. This isn't just about losing kilos. It's about protecting your spine, your posture, and your independence. When we gain extra body weight, it puts additional pressure on the spine, especially the lumbar region. Now this adds stress affecting disc health, spinal joints, and alignment. Over a period of time, posture begins to change to compensate. And the results? Muscular imbalances, nerve compressions, and pain. Well, here we need to discuss the role between our body weight and lumbar spine. Lumbar spine is responsible for supporting most of our upper body weight. Now, when we gain weight, it compresses the discs and pushes the spine forward into an unnatural curve of lordosis. This causes stiffness, nerve impingement, and risks of herniation. Now let me zero in on abdominal fat. Shockingly, extra abdominal fat alters the body's center of gravity. The spine compensates with forward leaning posture. It will tighten some muscles while weakening the others. Besides shoulders slump, neck strains forward, and long-term postural collapse occurs. Now as weight increases, it doesn't just sit around your waist. It pulls directly on the spine. The increased load compresses the spinal discs, shifts natural curvatures, and forces muscles into chronic tension. Fat stored in the abdomen causes the pelvis to tilt forward, exaggerating the lumbar curve. This results in disc compression, sciatica, and early degeneration. Additional weight gain leads to systemic inflammation also, which weakens cartilage and slows down the repair of spinal tissues. The result? Pain that becomes persistent and hard to treat. Research also shows that for every 1 kg of extra body weight, the spine feels about 4 kg of added stress, especially when walking or standing. In Ayurveda, this excess pressure is seen as aggravated vata and depleted asti dhatu, which needs grounding, lubrication, and detox. By managing both the weight and spinal load, we reduce long-term risks of herniation, nerve compression, and functional decline. But let me tell you one thing, extra weight along with several other factors make things even worse. What are these factors? Let's see them. Sitting for longer hours, lifting objects incorrectly, wearing poor footwear, using soft mattress, and ignoring early stiffness. Each of these multiplies spinal stress under extra body weight. Now let me describe this in the lens of Ayurveda. In Ayurveda, excess fat accumulation is linked to Medho Dhatu imbalance. This weakens Asti Dhatu, that is bones, and aggravates Vata dosha in the lower back. The result is pain, stiffness, inflammation, and early degeneration. Now how Ayurveda treats it? We aim to pacify Vata, we reduce excess Medho Dhatu, and we strengthen bones and nerves, that is Asti Dhatu and Majja Dhatu. At Vardhan Ayurveda, our therapies focus on detox, balance, and nourishment. Let me give you some insights into our therapies. Abhyanga to reduce stiffness and improve circulation. Kativasti, which is oil pulling to relieve lumbar stress. Vastikarma, it is medicated enema to balance vata and support weight loss. Udvartana, a herbal powder massage to reduce that extra fat. Panchakarma, deep detox for long-term change. So we have talked about the relationship between weight and spine. We have talked about how Ayurveda helps. Now I will focus on dieting. Here's a key. Dieting stands for eating right. But I never suggest crash dieting, which is very popular nowadays. Suddenly you stop taking food and all. Your calorie intake reduces and you become confident of weight loss. Believe me, it does more harm to your body than any good. Why? Crash dieting can ultimately weaken your spine and immunity. In Ayurveda, we promote gradual correction like light, warm, fresh meals, no eating after sunset, Triphala at bedtime, herbal teas like cumin, ginger and fenugreek, and walking 30 minutes daily and doing some stretching exercises at least for 20 minutes daily. Gaining weight doesn't just affect appearance, it places your spine under daily strain. If left uncorrected, this strain becomes degeneration and that becomes pain. But you can reverse this path with awareness, with Ayurveda and with action taking. At Vardhan Ayurveda, we see lives transformed not by chasing weight loss, but by restoring balance, relieving pressure and empowering mobility. So if you are on this journey, take heart. You don't need to suffer. You need a strategy. If today's video helped you understand your spine better, subscribe to our channel. We bring clarity, not complexity. Tradition, not quick fixes. Click that bell icon so you can never miss an update. Stay strong, stay aware, take care of your spine.